Hello, everyone, and thank you so much for joining us. This is Georgie Carter from the Health Policy Plus project. I'm delighted to welcome you to today's webinar entitled Advancing Indonesia's Equitable Health Policy Through Strategic Capacity Strengthening Partnerships. We'll have a great discussion lined up for you today, and we'll begin with just a few announcements. This session is being recorded, and we will post the recording to the Health Policy Plus website. We would love to hear from you and we welcome your questions at any time. Please submit your questions on the right-hand side of your screen, and we'll read them live when we have time for questions at the end. Now, these web conferencing platforms are getting a high volume of traffic these days, so we ask that you bear with us just in case there are any glitches with the technology. And finally, we ask that if you are not speaking, please mute yourself to keep the line nice and quiet while others are talking. And that concludes our announcement portion, and it is my pleasure to hand it over to my colleague, Deswanto Marbun, the Senior Program Advisor for H+ Indonesia. Hanto?
Hello, can everyone hear me? Okay. Hello, everyone. Thank you for joining us for this webinar, during which time we will be discussing topics related to advancing Indonesia's equitable health policy through strategic capacity strengthening partnerships. My name is Deswanto Marbun, and I'm the Senior Program Advisor for the USAID-funded Health Policy Plus project in Indonesia. I want to welcome our speakers who will be participating in today's panel. Joining me today, we have Dr. Sunita Sarma of HP+, Ibu Dewi Amila of the Ministry of National Development Planning, Bappenas, Lubov Terpliskaya of HP+, Pak Dr. Slamet, the head of the National Institute for Health Research and Development, Badan Litbangkes, Prof. Anwar Musadad, also from Badan Litbangkes, saya Kakoseki of HP+, Ibu Dr. Kalsum Komariani, the head of the Center for Health Financing and Health Insurance, PPJK, Ministry of Health, Anastasia Susanto of USAID, Jack Langenbrunner of USAID Indonesia, and Pamela Foster of USAID Indonesia. Our panelists will be covering a full agenda today, which will include a look at overarching project achievements, a deeper dive into the costing of Indonesia Midterm Developing Plan and its budgetary space analysis for health, maternal newborn health data analytics, public partnership activities, cross-cutting issues, and we will hear from USAID Indonesia before we wrap up today's session. We want to thank USAID for supporting this webinar as well. We are grateful for all you joining us today. With that, we'll hand it over to Sunita to share some of the achievements from the Health Policy Plus project in Indonesia.
Thank you very much, Hanto. So I would like to thank all of the distinguished panelists and attendees for participating in this webinar today. We want to thank our colleagues at the Ministry of Health and the Ministry of National Development and Planning for the productive collaboration and for joining us here today. HP+ has been working alongside the Government of Indonesia since November 2015 to advance reform efforts to sustainably finance and equitably provide healthcare services. It has been a privilege to work in a country with such an ambitious UHC reform agenda, coupled with the challenge of being so economically and geographically diverse. As a global project, our approach highlights the need to do things differently, to tackle the hard problems on the road to UHC, such as how to make sure the right evidence is available to decision makers at the right time in the reform process, or working with government counterparts at the national and subnational level to ensure they have the skills to advocate for the resources needed to promote equitable access to high quality health services. To that end, with our government counterparts in the lead, HP+ technical assistance in Indonesia has focused on conducting assessments and analysis, generating data and evidence to support policy decision-making, and strengthening the capacity of key stakeholders to take this work forward and ensure the sustainability of health reform priorities. This includes approaches to address the challenges and opportunities of decentralization, including developing evidence for decision-making that is differentiated at the subnational level, and creating tools to build the capacity of subnational government counterparts to plan and effectively budget for implementation of minimum services standards for healthcare service delivery. The HP Plus project knows that the strong policies that have strategic and evidence-based implementation plans are fundamental to achieving improved health outcomes. We have been honored to work with the government of Indonesia on local solutions that support progress towards universal access to healthcare, improved maternal and child health outcomes, and sustainable financing of its response. All our efforts have been made in close collaboration with our government partners to ensure that the tools and insights we generate through the process is guided by and embedded within the Indonesian government and other key stakeholders. This shared commitment to capacity development and collaboration is centered around three primary objectives of improved capacity for data analysis, sustainable financing, and strengthened private sector partnerships. I have been so impressed with the wide range, the breadth and depth of the technical assistance activities undertaken in collaboration with the government with USAID's support. I would like to highlight a few notable achievements from our collaboration. The successful transfer of tools and skills to assess the sustainability of the JKN scheme to government and academic counterparts under the comprehensive assessment of Indonesia's national health insurance scheme. The increased capacity of civil society organizations working on HIV to effectively conduct budget advocacy as a result of improved costing and evidence generation. The development of minimum services standards in health and public-private partnership learning materials now used by more than 2,000 health sector civil servants across Indonesia. Lastly, it would be remiss to not mention the way USAID supported USAID HP Plus to pivot and during the COVID-19 pandemic, where we adapted our approach to providing technical assistance and assessed the impact of the pandemic on subnational government financing and household financial risk protection. We won't be able to cover all these activities in this webinar, so today we'll focus on three specific activities to share. The healthcare costing activities using the One Health tool with the Ministry of National Development and Planning, Bappenas, the maternal and newborn health data analytics activity with the Ministry of Health's Research Institute, Litbangkes, the public-private partnership activity with the Ministry of Health's Center for Health Finance and Insurance, PPJK. We hope this will be an insightful session. We appreciate our government partners as well as USAID Indonesia for their participation and look forward to a lively discussion. With that, I would like to pass the microphone to Anto to share a bit more about our program achievements.
Thank you very much for this overview, Sunita. The first of technical activities that will be discussed in greater detail in this webinar relates to the partnership with Litbangkes to bolster capacity to conduct evidence-based MNH analysis. Additionally, HP Plus work hand-in-hand with PPJK on the minimum service standards costing exercise, developing structured learning tools through e-training modules so that the best practice in budgeting and planning for SPM is accessible and available throughout the country. HP Plus developed province-specific HIV service cost estimates and examine potential domestic financing options for reaching national HIV targets, which has allowed policymakers to define its near-term targets in HIV service coverage. The next slide. Yeah. In year one, the project completed a private sector and civil society landscape for MNH, which led engagement with the national team for the acceleration of poverty reduction, TNP2K, in year 2 and 3, to conduct an assessment of the National Health Insurance Scheme, JKN. Under Objective 2, an RPJMN costing activity was undertaken in year 3 to year 5 and is another example of the application of global best practice in Indonesia related to strategic planning using the One Health tool. Later in the webinar, we will take a closer look at another sustainable financing of essential health services activity related to health budgetary space analysis. HP Plus also provided strategic support to the National Social Security Board, DJSN, to strengthen stewardship capacity for the social security sector, and to the Ministry of National Development Planning Plan, Bappenas, in the health sector process, the HSR. Over the past year, HP Plus supported the government of Indonesia in addressing the COVID-19 impact on the health financing system. HP Plus engaged PPJK in assessing how resources were channeled during the pandemic response and developed several robust and replicable recommendations regarding health crisis financing at the subnational and at the household levels. HP Plus also continues to coordinate closely with the GOI in leveraging private sector engagement for better health outcomes, which we will hear more during the third deep dive conversation today. With that, I would now like to transition to take a closer look at the healthcare costing using the One Health tool. With the support of Health Policy Plus project and USAID, Bappenas analyzed costs required to meet Indonesia Midterm National Development Plan (RPJMN) 2020 to 2024 targets at the primary healthcare level and provided recommendation for the next budgeting cycle. The policies within the RPJMN 2020 to 2024 are directed at improving healthcare services, progressing toward universal health coverage, in particular, strengthening primary healthcare. The primary tool that was utilized in the costing of the RPJMN was the One Health tool. The use of this tool is of particular importance from both an implementation of global best practices perspective, as well as to promoting knowledge sharing. The One Health tool is a globally recognized multi-year strategic planning and budgeting tool for the health sector, developed by UN Interagency Working Group on Costing that has been used to cost strategic plans in over 25 low and middle income countries. In this activity, it was utilized to estimate costs for 7 priority programs: RMNCH, immunization, malaria, TB, HIV, nutrition and NCDs, across 4 categories: medicine, vaccines and supplies, socialization, advocacy and technical guidance, operations, and human resources. Several of the key recommendations included in the RPJMN report align closely with some of the health reform key strategic areas proposed by Bappenas and Ministry of Health. First, there's the need to review and improve allocation scheme and incentives to empower health workers. This is in accordance with the first pillar in the strategic area for key reforms. Second, as will be addressed in greater detail later on in this webinar, the involvement of the private sector in health services is a key strategic importance. As such, the RPJMN analysis calls for the close collaboration and coordination among public and private sector healthcare partners in the implementation of the recommendation. Third, in support of innovation in health financing, the report also recommends improvements to the efficiency and effectiveness of health budget utilization, especially for DAK non-physical DAK, particularly for BOK, and the deconcentration fund, Dana Dekon. Lastly, there's also room to optimize information technology to ensure that monitoring and evaluation system, as well as some programmatic activities such as training, supervision, and technical guidance are digital, as the use of electronic devices that have been piloted in Indonesia demonstrates technical efficiency gains in the health sector. In the wake of COVID-19 pandemic, during which time we observe a downturn of Indonesia GDP, understanding ability to fund the health sector becomes a key priority. With this in mind, it is important to highlight the complementary activities undertaken in conjunction with the RPJMN costing under Objective 2 of the project to support sustainable financing of essential health services. While RPJMN defined what it would cost to achieve Indonesia primary healthcare targets, additional analysis was needed to understand the available budgetary space to finance the cost. So HP Plus provided technical guidance to an academic experts from Universitas Indonesia to estimate the budgetary space for health from 2019 to 2024. The budgetary space analysis involved working closely with the Ministry of Finance to validate macroeconomic assumption, provincial and district government spending, and other projections necessary to determine the budgetary space for health in Indonesia. As a result of this analysis, HP Plus and UI experts produced and submitted to USAID and Bappenas a summary brief in English and in Bahasa with the main findings and policy recommendation. The results from this sub-activity were also widely disseminated through a webinar of similar studies with representatives from other regional partners. So subsequently, HP Plus engaged Professor Teguh Dartanto from Universitas of Indonesia to develop a how-to manual for conducting a budgetary space for a health analysis, while at the same time hosting a master class on this subject for 50 ministry officials, including those from Bappenas, Ministry of Finance, and Ministry of Health. The learning opportunity and companion manual has broadened the technical capacity of policy analysts to assess the available budgetary space for health in order to develop more effective and efficient health policies and intervention, and to make informed fiscal decisions given macroeconomic condition and any potential obstacles. The training and companion manual are also hosted on the University of Indonesia website so that the government representative can access and apply these tools to their future health budgets. The majority of the participants in this training responded positively to the training method and acknowledged its practical application to their work and were interested in further trainings. The manual and master classes provide another step in the USAID journey to self-reliance that nicely hands over expertise to Indonesian experts to strengthen the health sector. With that, I want to welcome Mbak Amila from Bappenas and also Pak Jack and Mbak Anas from USAID to join in a discussion around lesson learned and progress since the RPJMN costing activity concluded. So, Bu Amila, I wonder if you can speak a bit about what you perceive as the key takeaways from RPJMN costing exercise. Are there areas require further support and improvement in progress to date, Ibu?
Okay, thank you so much for having me, Pak Anto, and in this webinar. I'm Amila on behalf of Pak Pungkas, Director for Community Health and Nutrition Bappenas. Good evening, everyone. Pak Slamet, Ibu Yani, Pak Anwar Musadat, and also colleague in DC, Pak Jack, Ibu Anas, and also despite all of the hard work that we have been done so far, Pak Anto and also the team last year trying to calculate the budget need to achieve the health target for 5 years. I think this is a very good opportunities for us to stop a little bit to evaluate the progress, what's going on each year on for annual government plan as an annual budget cycle. In annual government plan, like we call it RKP, which is implementation from RBJMN 2020-2024. I think to answer your question, for the first question, Pak Anto, from our study, we could like highlight 3 key takeaway messages. The first one is that The study points out that the budget for non-communicable diseases and maternal and child health and also immunization are the top 3 highest. In a COVID-19 pandemic, I think budget for immunization it really makes sense that need for increase. Interestingly, that the budget need for non-communicable diseases is also high cost in primary health care. So we need to, I think, to redesign how to intervene for more preventive and also more promotive level for NCD. The second one, I think the health financing itself is a very fundamental component in a health system. And the main concern is how to finance the health system sufficiently and distribute it equally based on the public health needs. In effort to achieve that, Law number 36, 2009 on health was enacted and mandate that the government allocate a minimum of 5% of its national budget and minimum 10% of its sub-national budget for health. I think after conducting this study, we realized that this course of 5% budget, it looks like a sailing budget is irrelevant since the need of the budget itself is beyond 5%. So actually, as a mandate, it's a floor. It's like a floor. It's a minimum standard for 5%. Therefore, we then is not focused only about fulfilling the 5%, but also we see more than that. The health budget should be disbursed in an efficient way and also an effective way to gain optimum health target achievement. I think the last point, we should reorganize our budget data, Pak, as a costing really deal with the unit cost. If the unit cost data isn't available yet, I think the calculation tends to use the reference that WHO has and USAID has for costing as well as expert judgment that we use. I think for you to address your second question related to the areas that need further improvement, sure that we need to include estimation of secondary as well as tertiary health services and also include costs incurred by the private sector. I think lastly, the exercise doesn't consider budget needs related to the COVID-19. In the COVID-19 pandemic, the budget need for several health infrastructure like medical equipment, laboratory, and also drug and vaccine needed to be increased, but several costs for training and meeting for health workforce may be lower budget than estimated, since most of the meetings are not getting online like we are right now. Thank you.
Okay, thank you, Mbak Amila, for very concise answer for the questions. Pak Jack and Mbak Anas, I would welcome any additional insights on both questions posed and your impression on this work as a whole.
Thanks, Pak Anto, and Selamat malam semuanya. Thank you very much, Bu Amila, for great comments. I really like your comments. Let me add a few things. First of all, I think the RPJMN exercise and targets were well done. And we were at USAID, we were happy to participate in this process. We provided some global expertise through people like Professor Peter Berman at Harvard, Palladium experts. Secondly, I think the development of training on the One Health tool and the initial estimates provide really an excellent platform going forward. I attended the sessions, which included the top analysts from Indonesia. Yes, as Bu Amila says, the COVID impacts will, excuse me, will need to be addressed. And this may require some rethinking of spending levels, but also allocation changes, new incentives, monitoring that includes accountability across all levels of government. I think the good news is that COVID has brought a deeper sense of the importance of the health sector. It really demonstrates the importance of health promotion, disease prevention, and primary care. And I think given the training and the baseline process of the analysis of the results of the options that were developed, we feel comfortable that the Bappenas team with the Ministry of Health and many other stakeholders in Indonesia can go forward post-COVID to achieve these targets and perhaps even more. Thank you, Pak Anto. Back to you.
Thank you, Pak Jack. Bappenas, if you want to add.
Thank you very much, Bang Anto, Ibu Amila. Thank you for joining us. Please also convey our gratitude to Pak Pungkas for the commitment and the contribution from Bappenas so far that allows this work to happen. I think my comment will be more related to what you mentioned just now in terms of ensuring that all of our work also cover the private sector component. So I think this is also relevant with other HP Plus work around public-private partnership and the importance of private sector towards the big kind of the big health services and the big contribution for us to achieve the development goals. So I think we can hear more and discuss more during our PPP discussion later on. So thank you very much for that. Over to
Thank
you,
you,
Bang.
Bappenas. Thank you for your contribution to the discussion. I would now like to hand it over to Lubov for a closer look at the maternal newborn health data analytics activity.
Thank you, Panto. I'm pleased to introduce our MNH data analytics partnership with Badan Litbangkes, or the National Institute for Health Research and Development. If everyone can please mute their line, thanks. So Dr. Slamet and Dr. Musadad, as we recall at the start of this activity, substantial evidence gaps remained in understanding why maternal mortality remained higher in Indonesia compared to most other countries in Asia, and why progress in reducing neonatal deaths had stagnated in Indonesia. We developed the MNH data analytics activity to meet this need to unpack the complex issues surrounding risk factors for maternal and neonatal mortality in Indonesia. And the National Institute for Health Research and Development, or Badan Litbangkes, collects a wealth of quantitative health data that's relevant to key MNH issues. And so we had developed this partnership in which HP Plus provided technical assistance to Badan Litbangkes researchers to improve their analytical skills, develop analyses to understand MNH issues, and disseminate findings to Indonesian policymakers. So we practice this learning by doing and one-on-one mentorship approaches by embedding a PhD level MNH technical advisor and data analysts to work closely with Badan Litbangkes researchers to ensure that skills, tools, approaches, and methodologies are embedded within the institution for sustained use in the future. So together, we conducted 11 methodological and scientific writing workshops to develop researchers' skill set in statistics and journal writing. And dissemination symposia were used to develop researcher skills in presentation of findings to policymakers and other audiences. To monitor progress and provide tailored support, we conducted capacity self-assessments among the researchers throughout the two-year partnership. And Badan Litbangkes researchers produced and submitted 5 journal articles to international peer-reviewed journals, which included BMC Public Health, the Journal of Midwifery, and PLOS ONE. And 2 articles have been published so far. Additionally, the researchers developed 5 policy briefs, which have been posted on Badan Litbangkes' website and disseminated to other units within the Ministry of Health, such as the Directorate of Family Health and the Directorate of MNH. As part of efforts to disseminate data and evidence to Indonesian policymakers, we hosted a session at the Prince Mahidol Award Conference in 2019 to gather WHO representatives, other Ministry of Health representatives from Southeast Asian countries, and Southeast Asian academics to better understand the role of non-communicable disease determinants on maternal and newborn health outcomes. And in addition, together we established a new external-facing public data visualization platform to aggregate Litbangkes' quantitative data. And we developed the database structure for this platform using Tableau analytics software and facilitated key consultative meetings to gain buy-in and approval for the development of the platform, which fit within the broader objectives of the new Ministry of Health One Data strategy. The Tableau training workshops were also provided to ensure institutionalization of the new platform at Badan Litbangkes. So here I'd like to highlight some of the key results in building researcher capacity that we developed together as measured between baseline and endline from our capacity development assessments. So key areas included improved knowledge of Indonesia-specific issues, policies, programs, as well as concepts and frameworks. And in addition, we achieved impressive gains in conduct of rigorous quantitative analyses. As you can see here at baseline, 44 to 50% of Litbangkes researchers indicated they were able to compile and analyze data and perform inferential and causal analysis, compared to 74% of researchers at endline. And similarly, we made substantial progress in improving skill sets on scientific writing for journal articles and development of evidence-based policy and programmatic recommendations. As you can see here, while 38 to 44% of researchers indicated these abilities at baseline, the number grew to 74% at endline. So through the 3 delays framework, we explored the factors that influence maternal and newborn health outcomes, including the influence of government programs on MNH utilization and outcomes. As part of the first delay in seeking healthcare, we sought to understand what are the household level determinants of MNH seeking behavior, and how do they differ across Indonesian provinces and by socioeconomic status. We also examined the role of the MNH program, including pregnancy classes or the KIH program, as well as the maternity planning and complication prevention program known as P4K. As part of the second delay, we sought to understand the barriers, both physical and financial, in reaching health facilities, and whether programs such as Jam Persal or insurance through JKN alleviated such barriers. And lastly, as part of the third delay, we sought to understand what factors influence mothers to receive adequate and appropriate treatment at facilities. And this included the role of waiting times, efficiency, availability of skilled birth attendants, and the strength of the referral system. Through the MNH data analytics activity, we informed several key health reform priorities in Indonesia. To contribute to the government of Indonesia's agenda to strengthen health promotion and prevention programs, we conducted analyses to understand the influence of 2 key programs on MNH service utilization. And these included the use of pregnancy classes as part of the KIH program in primary healthcare centers or puskesmas, and the role of maternity planning and complication prevention program or P4K in improving MNH service use. And to contribute towards the goal of improving health financing, we also examined the role of JKN in reducing out-of-pocket costs for delivery care. To increase healthcare access in underdeveloped regions of Indonesia, we explored the financial and non-financial barriers that mothers face in accessing maternal and newborn health services, disaggregated by SES or socioeconomic status and geographic region. And lastly, to improve community development efforts, we developed an evidence base and recommendations on women's decision-making autonomy in the households and the impact of traditional practices on MNH use. So I'd like to welcome Anas, Jack, Dr. Slamet, and Panwar to join us for a bit of discussion around lessons learned and progress since the MNH data analytics activity concluded. So Panwar, I wonder if you could speak a bit to how Badan Litbangkes has used findings from the MNH data analytics activity and skill sets that we developed during the partnership within the institution more broadly.
Thank you. Distinguished participants of this webinar, ladies and gentlemen, good evening to you all. First of all, I will thanks to invite me in this discussion, in this webinar with developing partner for Health Policy Plus. And also I would like to say that it is very good activities and it's work because it very useful activities. Why is it so? Because it addresses to what we need. For example, about the capacity building for researcher, how to improve the priority program for health. So again, that it is very useful activities. Based on our experience, key element for good collaboration with the development partner, for example, encompass clear objective, clear output, and also clear benefit, and also in line with the both the first one in institution role and as a policies formulation for NIH and health research and development, and also in line with researcher who are involved in the collaboration. As I mentioned before, that this is very important for researcher to involve the capacity building. How about the past of COVID-19 era? I think this important to discuss to face pandemic COVID-19, as we know that we can see in both sides. The first one, as pandemic COVID-19, it is challenges for us and how to handle it collectively, how to make policies inappropriate in the field, how to do tracing and testing, and also how to treatment COVID-19 patient in the field. And the second one, it is opportunity to stimulate to find invention or innovation, especially for health equipment or health services tools. So therefore, in my point of view, the goods government initiative in the post COVID-19 is how to transform health system to become real health services in field, including the how to increase accessibility in the all area in Indonesia, how to increase affordability to health services, health tool services in area of Indonesia, how to deploy human resources in every public health services, and also supported by IT. On the other hand, National Institute Health Research and Development right now also in processing to transform to become the Health Development Policies Agency. So we need to more in-depth training, capacity building in order to good to do how to formulate health policies in order to the better and better the next time. To make it running well, of course, again, we need capacity building. We need a good analysis of data. We need how to analyze scientific evidence. So again, how to improve the capacity building of the researcher in the Health Development Policies Agency or the National Institute of Health Research and Development. Thank you.
Thank you, Dr. Slamet, for those comments and speaking more to Badan Litbangkes's priorities right now, especially in light of COVID-19. And as part of the effort to lead health policy evidence-based decision making, can you speak a bit more to how the new data visualization platform, may be furthering these efforts, how it's been used by the government, academics, or others, and maybe what the remaining challenges are in data use in Indonesia, and if there's been any other efforts to address those challenges?
Of course, we should invite the academic person from the university to involve to give like guidance in order to work together with the health policy development agency.
Great. And Anas and Jack, thanks again for joining. I would be curious to hear how you think this work has advanced the priorities that you've seen government of Indonesia highlight in its post-pandemic health agenda. Do you have any comments about that?
Sorry. Please repeat again.
Yes, just to all panelists, I'm curious to hear how this work has advanced the priorities of the government in post-pandemic health agenda for the government of Indonesia.
How to transform the health system to the real health services in field. Of course, this is the big idea, but we can divide it the sub health system. The main point is how to implement the health services in the field. For example, the main point how to deploy human resources in every public health center. How to good health services in the all area of Indonesia. Of course, be supported by IT.
Hi, Lubov. If I can add as well, thank you very much, Dr. Slamet, Pak Slamet. Thank you for what you shared just now. Thank you, Prof. Anwar, also for joining, and Ibu Meli for joining us tonight. I think I want to echo what Pak Slamet mentioned just now. I totally agree that information technology is something that is crucial to transform the health system, so we can become and we can provide real health services in the field. We can increase accessibility, affordability, and also how we can deploy human resource for health and public services, or also maybe to also understand the needs at the private health services as well. We are happy to hear that you think our assistance helps Badan Litbangkes researchers to improve their capacity related to data analysis. In addition to that, we are also glad to hear that there have been efforts for data sharing between directorates and also for data visualization. I think these are very important components of the principles in the digital development.
One point again, sorry. How to increase the involve of the private sector to contribute to the health services in the field. Thank you.
Yes, I totally agree with you, Pak Slamet. That is very important, and that's a critical information that we need to inform our decisions and also the process within ourselves. I think when you mentioned about transforming digital health, I think I also see a lot of documents from Bappenas as well.
Hello.
Yes, Pak Anwar.
Bu Anastasia, I
Yes.
want to respond you Bob question. Yeah.
Please go ahead, Prof. Anwar.
Yeah. One of Litbangkes key performance indicators is policy recommendation. Therefore, the policy recommendation resulting from our collaboration with SV Plus are part of what we have delivered to health program units. Our activities included capacity building in well-structured writing that resulted scientific articles for publication. I want to inform you, two of them received attention and appreciation from Ministry of Research and Technology. What had been done with SP Plus has set a new standard for Litbangkes researchers, specifically in scientific writing. Thank you, SP Plus.
Thank you, Panwar. That's great news. That's great for us to hear too. Anas, did you have any other comments that you wanted to add, or would anyone like to add any comments on opportunities to improve capacity development partnerships like this between us in the future? Jack?
So thanks, Pak, thanks, Prof, thanks, Bu. This is an excellent discussion. Makasih banyak, really appreciate it. You know, we found out in the RPJMN process that outcomes have plateaued. So we sort of knew that, but then we saw the numbers again. And I think that this process is very important, very key going forward, because the analytics, you know, tell us what we're doing well, what we can do better. And I'm really impressed with the baseline end line numbers. Those are significant jumps. So that was a very nice slide, very nice numbers. And you know, speaking from my own experience, it's often a matter of feeling confident, having the courage to jump into some of these data and do the analysis and come up with some options and conclusions. So I think this is a great effort by everyone, and very pleased to see. So thank you so much. Back over to you.
Thank you.
Thank you, Jack, and thank you, Dr. Slamet and Dr. Musadad, for your contributions. Thank you, Anas. Just to move forward, I'd like to hand it over to my colleague Sayaka for a deeper dive into the public-private partnership activity.
Thank you, Lubov. I hope everybody can hear me okay. It's a pleasure to be presenting on our partnership with Center for Health Finance and Insurance, PPJK, within the Ministry of Health. On the line with me is Ibu Yani, who's the Center Director. So I'm really thankful for her joining me on this. And if I may do a little bit of introduction to the partnership that we had together on this journey. We started it for the audience. Public-private partnerships globally have led to healthcare delivery systems that create consumer choice and provider responsiveness, and are often associated with more rapid adoption of innovation and technology. And so, you know, government of Indonesia has been taking on public-private partnerships for some time now. It certainly isn't something new to Indonesia. I recently saw a blog by the Ministry of Finance that they wrote about summarizing their recent years of success in infrastructure public-private partnerships across various sectors. And they mentioned about 5 key areas to achieve this progress. First is establishing a clear policy framework, creating a high-level committee, and then setting up a financing support for public-private partnerships, as well as establishing a dedicated PPP unit, and then ultimately working with all the development partners to participate and support this vision. So it was a nice summary, because it turns out that we had been following the footsteps for health as well. And so specifically talking about public-private partnerships in health, Ibu and her team had spearheaded an effort in establishing a similar policy for infrastructure PPPs in health back in 2018. That will be, for example, building and operating public hospitals by private sector. But when we came together almost 3 years ago, Ibu had highlighted the importance of non-infrastructure PPPs, or what we will call health services that doesn't necessarily have an infrastructure component to it. So PPJK and HP Plus has worked closely to create a movement around improved private sector engagement with the government as part of a strategy for sustainable financing. This is culminating in an adoption of a ministerial regulation on public-private partnerships for health services. At the same time, we've been working to create several partnerships opportunities between the government and the private sector. So, but before we dive into all the details, for our audience, I wanted to take a step back to talk a little bit about why PPJK and the Ministry of Health has been prioritizing PPPs. As I mentioned, public-private partnerships, we've been working together for a few years now, and at that time when we started our partnership, I remember Ibu saying how important it is to leverage the private sector in expanding services and doing so more efficiently. And really what public-private partnership does is to create a sustainable approach to creating a social benefit. The government sets the priorities around health services that the population should have access to. And by partnering with the private sector through various contracting mechanisms and partnership mechanisms, it creates a business opportunity, and ultimately the Indonesian people benefit through greater access to care that is still affordable. So at that time, when I was having this conversation, our team was having conversation with Ibu and her team over at PPJK. This was pre-COVID times. We were talking about how the rollout of JKN, the National Health Insurance Scheme, was a good example, one example of public-private partnerships related to health services, because it created a way for the government to set a price and pay for specific quality of care offered through the private sector. But certainly things have evolved quite a bit since then, especially with COVID, on the various types of partnerships. I've highlighted here some of the efforts that the government has been doing with the private sector in recent years. For example, there's the vaccine rollout, COVID vaccine rollout that is happening in Jakarta and Bali, and planned for a more national scale up with the private sector, where much of the logistics and coordination is spearheaded by the healthcare and tech companies. So that's one great example of a public-private partnership that has formed in COVID. There's many other initiatives that's listed here, but for example, joint ventures with between government and private hospitals to provide TB testing and expanding access to TB testing and treatment. So we seem to find these partnerships here and there, but I think what the issue was is that they do tend to be a little bit ad hoc and often small scale, and don't have clear reporting lines. Ibu you had mentioned about how the contribution from the public and the private sector in these partnerships are not documented because of a lack of reporting requirements and structures. So at the same time, there were apprehension around private sector engagement with ministry units and local governments not being sure how they can use their funds in collaboration with the private sector. So when you have regulatory kind of fuzziness, it makes it very hard for the government entities to actually try to take something on, even if they think it's a good idea. They just want to make sure that they're following the the law, and when the law isn't clear, they defer to being a little bit less risky. And I think that has been part of the issue about, or at least one of the issues, why public-private partnerships in health hasn't necessarily evolved. So it seems that the work that we started together a few years ago was so timely, as the need for partnerships right now and the mobilizing of resources for health is stronger than ever. So to dive into thinking about our approach to creating a movement and institutionalizing PPPs into health, Ibu Yani, you recommended 3 work streams. First, we needed to establish a policy framework around PPPs, as I just mentioned. Promoting partnerships to be taken up across the health sector requires clear guidelines around how these partnerships can occur, in what way, using what type of funds, and how it will be monitored. At the same time, we're working to establish a PPP committee under the Secretary General, which will help continue to be a resource to the ministry units and private sector in creating and monitoring partnerships. Second, Ibu Yani, you mentioned how important it was to create various venues for knowledge sharing. So over these last few years together, we held a good number of workshops and webinars and supported several government representatives to take a course on public-private partnerships in health. And all in an effort to share global, regional, and local experiences around PPPs. Most recently, PPJK, your team, and HV Plus hosted a workshop with public and private sector stakeholders where we did a role-playing session on co-creating partnerships. Unfortunately, I was not able to join since I was over in Washington, D.C., but I heard that it was quite a lively session, sitting in each other's shoes and learning about the partnership process and actively creating new ties across the sectors. So having these types of face-to-face collaboration opportunities also break down barriers between the two sectors. And then finally, I distinctly remember you saying how important it is to create a public-private partnership pilot as we work on this policy and knowledge sharing, in essence, to be a use case of this PPP policy. We all agreed that hands-on, rubber meets the road is where we truly learn. And so we've had one specific opportunity around maternity waiting homes and community screening, which is gaining traction. And at the same time, we've created a significant pipeline of opportunities that could be pursued by the PPP committee once established, such as around childhood immunization, research and development, technical training, and health IT and reporting efficiency. So from the bottom up, top down, from the sides, we've worked together with so many stakeholders to create awareness and interest around public-private partnerships in health. So to wrap things up, tie things in a knot, we're wrapping up. We're in the final push on this private sector activity with you, Ibu Yani, and your team. So I'm excited to share a little bit of what's coming up with our audience. We have the public-private partnership policy that's been reviewed and endorsed by both public and private stakeholders and is currently going through the ministry's official process for adoption. I think there's also a greater sense within private businesses around government priorities, so that when their business goals align with them, they know how to actively reach out to co-create partnerships. On the PPP pilot side, specifically around this maternity waiting home partnership, the concept has been adopted by the local government with their commitment to contribute their own public resources, notably infrastructure, to create this partnership. And we're excited to have several private sector partners on board to contribute to the upfront investment and program implementation. in this process, we've created a lot of interest around maternal and newborn health, as well as nutrition and healthy lifestyle among the private sector. And so understanding that the government's basic package of health services focus on maternal, newborn, and child health, it's exciting to hear from them that there's already interest in replicating this model across other districts once we see this pilot get going. So really kind of tying back to how public-private partnership really contributes to the sustainable financing of health services down the line. And as we wrap up the process, we look forward to documenting more lessons learned and critical steps that the government of Indonesia can take with PPJK's leadership moving forward. So with that, I think I have spoken long enough. I wanted to thank you so much for joining me, Ibu Yani, again. Hopefully Jack and Anna from USAID also can join us for a little bit more discussion around the public-private partnership activity with us. So I have a couple of questions for you, Ibu Yani, that hopefully you can speak to from your perspective and your experience. I wonder if you can first speak to a bit more about the government's internal capacity challenges that you saw as you initiated this PPP policy development process. What was the major challenge you foresaw that you wanted to make sure we can overcome together?
Thank you, Sayaka. First of all, it is my great pleasure for joining this webinar, and good morning everyone in US and good evening in Jakarta. As one of the strategy of our health development in Indonesia is to strengthen the health system, and one of the subsystem of health system in Indonesia, also in many other countries, is health financing. And as one of middle income country, in Indonesia has the total health of expenditure is still low. And then we are thinking how to increase our spending on health. So, and then in order to mobilize some potential source of health financing, we are thinking about the public-private partnership in health area. So we initiate to develop a regulation. It is a ministerial decree because it is important. Actually, the public-private partnership, it is already done, but maybe still scattered and unorganized. So that's why we need a comprehensive regulation. And then our major challenges when we are starting to think about the public-private partnership is we realize we have less capacity. The team have less capacity, and also the team less experience work with and coordinate with the private sectors, and also to engage with other regulation. And then we are welcoming the HP Plus program to support us, and we knew that it is not easy because some work we have done under before the pandemic, and then after that we are working together under the pandemic period, which is it is not easy, but now we are at the end to finalize our ministerial decree. So I think we need to say thank you to HP Plus for the support. I offer to Sayaka.
Thank you, Ibu Yani. And it's been a pleasure working with you and your entire team. It has been a fantastic collaboration throughout this process. I wonder if you can speak a little bit more, if you have any thoughts around the type of support that you found critical or most helpful.
Yeah, because this program is something new for us, and then we are facing some challenges, and then I think this support from HP Plus it is helpful for us. They are about some support for providing the technical assistance for PPJK team, and then also when we are identifying and mapping the regulation, especially to find the gaps that was worth to intervene and for making the regulation for non-infrastructures. And also HP Plus assists us in coordinating to the private sectors, because it is important. Some private sectors, they have role to join this PPP scheme in Indonesia. Yeah, I think many support from HP Plus. Thank you.
Thank you, Ibu Yani. And I'm sure the audience would love to hear from you. You know, when you hope to see this policy adopted, this ministerial regulation adopted, and the PPP committee established. Do you have a sense? And also, what are the key next steps for P2JK?
Yeah, as I said before, we have the target at least at the end of this semester or at the beginning of next semester, we will launch the ministerial decree. And then the next step, we need to socialize and also to advocate some local government, maybe other government institution. And yeah, after that, the adoption of this PPP on non-infrastructure should be improved, should be done in Indonesia. And the important thing is when we are formulating the regulation, also we put some point that this all PPP non-infrastructure area activity should be well documented.
Great, thank you, Ibu Yani. I'm looking at the time, but maybe if I could give the opportunity maybe to Anas over at USAID Indonesia, if you have any quick thoughts or reactions, having you've been such a strong partner and endorser of this work with public-private partnership policy for some time. If you have any parting words.
Thank you very much, Sayaka. Thank you very much as well, Ibu Yani, for what you shared just now. I think PPJK has been a great partner, and the Ministry of Health has shown a strong commitment to realize this public-private partnership, especially through the development of this ministerial decree for PPP non-infrastructure. I think I've been following the development process. It has been both rapid and comprehensive as well. It includes consultations with various cross ministries, but also with private sectors as well. So I applaud that effort and that comprehensiveness. However, I also still, and here what Ibu Yani mentions, there are still a lot that we need to work together with, especially to improve the private sector engagement. There are a lot of things we need to do, and also following up with what Ibu Amila mentioned at the beginning, to make sure that we can engage and cover private sector contributions towards the health sector in Indonesia. I think we, Indonesia, we can be a model. There's a lot of smart ways that we can do and take lessons learned from other countries as well, similar countries. But I think PPP takes time and patience as well, as we need to be able to address interest and challenges and also establish mutual benefits to ensure sustainability and impact towards the community. I'll stop there. Thank you, Sayaka.
Thank you, Anas. Yeah, thank you very much for this very fruitful discussion, all of you, and Ibu Yani especially. Ibu Yani, Anas calling in from Jakarta very late on a Friday evening, no less. I look forward to hearing a little bit more in our next session with Anto about takeaways on partnership for policy development implementation. So I close the PPP section of this agenda. Thank you.
Thank you, Sayaka. I would like to invite all of our GOI panelists and our USAID colleagues for a discussion around takeaways on partnership for policy development and implementation on Indonesia, given our shared experience to date. So we've spoken to a variety of ways in which USAID HP Plus has collaborated with all of you as our important government counterparts. So I would like to invite Dr. Slamet, Ibu Yani, Ibu Amila. Maybe can each of you take turn to speak? What are the key elements to make partnership work or not work? And also, I also would like to ask the second question: what would like to see more of in support of government initiative in post-COVID era? Over to Bu Amila or Ibu Yani first. Ibu Yani.
Go ahead, Ibu Yani first.
Yeah.
Go ahead, Ibu.
Silakan, Ibu.
Yeah. I think the first of all, I would like to thank for the existing support from HP Plus. And when you ask me about the kind of support under in post-COVID era, I still believe that type of support that we still need is how to improve the capacity. I mean the capacity building, and also we still need the technical assistance. Yeah, especially in health financing area, because we believe in 5 or 10 years in the future, health financing is one of the area of health that should be improved in Indonesia to support health development in Indonesia. I offer to Pak Anto.
Thank you, Bu Yani, for your response. Bu Amila, over to you, Mbak.
Thank you, Pak Anto. I think I also will add that Ibu Yani said, we are in Bappenas. It's just like stand between priorities among the priorities. So we need to select which one of the most priorities. So we should deal with the competing priorities. Developing tool, I think, for health budget for making more efficient and effective ways is really matter, giving the limited budget resources for the post-COVID-19. I think we realize that our government budget is contracting right now. If you're looking at bit into what happening today, the COVID-19 pandemic is also points the weaknesses for the health system. I think the more areas that we should strengthen is health system reform that proposed by Bappenas and also endorsed by Minister of Health by transformation of the health system. So I think the area that health system itself should be defined as a strategy that should be deal with the costing as well. So we call it in Bappenas is competing priorities. So I think in the next agenda that we need to support from development partners related to the post-COVID era is just like we need to see which one the most important point, and then we should dig dive into more effective and efficient ways. But the last point from me is just like there is an urgent needs that the piloting project have been done by the international development partners needs to buy in by the government. So there is should be set in the beginning that is scale up in a nationwide. So it's not only the piloting projects every single time. So set from the beginning to be nationwide and then institutionalized to the government. I think this is the key for our partnership in the next that we think from Bappenas. Over to you, Pak Anto. Thank you so much.
Thank you, Bu Amila. I see Prof. Anwar here. Maybe if you can also share your thoughts, Prof. Or I haven't seen Dr. Slamet. If Pak Slamet's also with us, but up to you, Pak. Prof. Anwar, maybe you can share your thoughts too.
Please, Prof.
Mr.
Anwar.
Slamet, Pak Slamet.
Yeah, please.
Okay, Pak Slamet.
Yeah. Please, Prof. Anwar, then me.
Okay.
Okay. Yeah. After the change, Badan Litbangkes nomenklatur transformed into health development policy agency. The role of SP Plus has become more important. Thank you.
Thank you, Prof. Pak Dr. Slamet.
Yes, in my point of view, that the most important thing of the sub health system is how to deploy the health resources, human resources in the public health services, and then supported by technology, IT. That very important to and these issues also the main issues from my minister. Thank you.
Thank you, Dr. Slamet. I think it's aligned with one of the key health reform area in innovation and technology. I think, Mbak Anas, if you can also share your thoughts on the responses coming from our GOI colleague.
Thank you, Bang Anto. I think from my side, looking from the perspective of donor or international partners, I think hearing what Ibu Yani mentioned just now, Ibu Amila, Prof. Anwar, and also Pak Slamet, it's a positive tone in a way, because we know that our government counterparts understand the needs. Where is the gap? Where is the technical assistance? Where is the capacity building needed? So I think from our side, it really helps us in designing and strategically kind of select the areas for our partnership together. We need to establish a common goal, because we know that we have limited resources as well. So I think in terms of the key takeaways on partnership is understanding the needs of the government counterparts, as in this case, Bappenas, Ministry of Health. They have been very engaged with us in designing this, in identifying the needs. So this this is the key, I think, from my side to ensure a successful partnership for policy development and implementation. I think that's from my side. Thank you very much, Pak Anto. Back to you.
Thank you, Bappenas. Thank you all very much for your thoughtful insights and reflection. And now I would like to request Pamela Foster, Ibu Pamela, Health Office Director from USAID Indonesia, to deliver closing remarks, highlighting areas of interest and opportunity based on our discussion today. Over to you, Ibu Pam.
Great. Thank you all. And let me begin by once again conveying my sincere thanks to all of the speakers and panelists for participating in this session today. Particularly, I appreciate the time and commitment of our PPJK, Bappenas, and Badan Litbangkes colleagues, not only on a Friday evening here in Jakarta, but certainly over the past 5 years. The breadth and scope of our partnership has been impressive, ranging from an examination of potential domestic financing options for reaching national HIV targets to COVID-19 vaccination preparation at the provincial level. But even more important has been ensuring that all of the activities align with the ministry's priorities and strategies. And I think the discussion over the past hour or so has highlighted this. All of the speakers noted the shifts required because of the COVID pandemic. And this was on both sides of the partnership, looking at what analysis was needed and then how to deliver it to make it responsive to government priorities. It was exciting to hear that the coordination with Bappenas enabled policymakers to conduct analysis on health budget space in Indonesia. Certainly, as we've heard, in the time of COVID, where the needs are high and government priorities and the budgetary space is shifting, I'm hopeful that these tools and approaches will be helpful not only now, but in the future going forward. Equally important is the partnership with Badan Litbangkes in the maternal newborn health data analytics activity, and the insights this work has provided related to ensuring efficient access to emergency obstetric care services for Indonesians. It's delightful to hear of Badan Litbangkes' continued investment in building researchers' analysis capacities. We know that doing the data analysis, the decision making, the policy work is a long, hard slog, but it's really critical to ensuring that all of this work translates into improved health service delivery on the ground. Of the many innovative health financing activities that HP Plus and the government of Indonesia have cooperated on to date, it's been particularly exciting to watch the evolution of the public-private partnership policy for health services. I very much look forward to the ministry's official adoption of the PPP policy. It's an important step that will help all sectors come together to understand how they can contribute to the national priorities of improved health outcomes. It's certainly an approach that is important to USAID. We have focused on elevating private sector engagement over the past several years, including by developing an agency-wide private sector engagement policy. We continue to learn a lot as this evolves and unfolds, and certainly the experience and learning from here in Indonesia will continue to inform this policy improvement. Nonetheless, we are eager to continue supporting the government of Indonesia's efforts in scaling up public-private partnerships. This opportunity to take the time to reflect on the progress that we have made together and the challenges that have been overcome is of particular importance as we continue to work together to respond to the COVID-19 pandemic in Indonesia. It's clear that innovation and collaboration remain key factors to creating a resilience response systems in Indonesia. I'd like to thank you all again, our government partners and our HP Plus partners, for taking the time to share your experience, your lessons learned, and to help us all collectively and globally understand how partnerships can contribute to future advancement for Indonesia's health priorities. We look forward to incorporating these lessons learned and in future partnerships with the Ministry of Health, and we hope that they will also be taken forward in other countries where HP Plus is working. Terima kasih banyak dan selamat malam semuanya. Thank you very much, everyone.
Thank you for everyone participating in this webinar. Thank you for GOA panelists and participants who were willing to spend their time to join webinar Friday evening. Really appreciate it. Thank you Bapak Ibu semuanya. Thank you for USAID Indonesia. Thank you for all HP Plus DC and Jakarta teams for the support for this webinar. Wishing you all good weekend ahead. Stay safe, stay healthy.